Welcome back, everybody. We are here with our family, Val B, as we like to call her, Valerie Bertinelli, everybody. And our resident doctor, Dr. Kameelah Phillips. And that's right, she's our rock. And we want to unpack something that we've talked a lot about on this show. I personally have had 2 mammograms on the show. And the subject of breast cancer is not just Breast Cancer Awareness Month, but it is an all-year-round perennial subject that we love to approach here on the show.
We are joined here by a member of our CBS family who has been making headlines for sharing her incredible breast cancer journey. So please welcome Inside Edition's Alison Hall.
You dare to be brave enough to put yourself out there. So will you talk to us about that journey you've been going on?
Yeah, it's a big one. I'm at Inside Edition every day, used to telling other people's stories. And it was actually through an Inside Edition story that I discovered that I had breast cancer at the age of 32 years old. I was reporting on Olivia Munn's breast cancer diagnosis. She came out last spring and said that she had been diagnosed with breast cancer and had undergone surgery, and she had said that the way that she found her breast cancer was her doctor suggesting something called the breast cancer risk assessment test. So over at Inside Edition, a big celebrity, you know, it's news for us. We went, okay, let's cover this. And let's find out, what is this breast cancer risk assessment test? Alison, head up the street to Lenox Hill Hospital, interview a doctor, and find out what this test is. And my bosses said, are you okay taking this test on camera? And much like you, Drew, doing a mammogram on your show here, I said, of course, let's do it. Anything to raise awareness. So I answered the series of questions that make up the test. And at the end of the test, the doctor said, you have a 36% risk of having breast cancer in your lifetime. Olivia Munn's breast cancer risk was 37%. Anything over 20% is considered high, and it means you should go for follow-up exams. So I took that very seriously, of course. I went back, I got a mammogram, they saw a couple things, I got an ultrasound, they said all good, but come back in 6 months for an MRI. So I waited a few months. In October of this past year, I went in for my first breast MRI, and I sort of thought about it as like a dentist appointment. Every year, I'll just go and get a mammogram and get an MRI and move on, and that's it. So I didn't expect that the very first breast MRI that I had, they would call me that very same day and say that they had found 2 spots that they needed to biopsy. And I went in for biopsies, and I waited a few painful weeks, and then I found out that I had been diagnosed with stage 0 breast cancer at the age of 32. When I heard that diagnosis, of course, I was very upset, but I raced home, and my husband reminded me through tears, this is the best bad news that we could have gotten. Stage 0 is the point of early detection. Everyone talks about early detection and raising awareness for breast cancer. I am the model child of that, because I was actually able to benefit from it, getting that stage 0 diagnosis rather than catching it at stage 1 or 2 or 3 or so on.
Well, Dr. Kameelah, can you tell us what the GALE
Yes, thank you. Thank you so much.
Thank you so much. So the GALE model is the breast cancer risk assessment tool that we use, and it's just that. It is a tool that your healthcare provider will use to help you understand your risk. You mentioned that anything over 20% is advanced risk. So average risk in our lifetime, about to age 90, is about 13%. Now, there are other models. So before you run to the internets looking for this model, you really need to engage your doctor, because there might be models that are different for you. So the GALE model is going to ask your age, first period, first baby, if you've had a breast biopsy before, which you did, and if that biopsy is abnormal. Other things might play a factor, but when you get your risk, you better understand if you're someone who should go on for further testing. So it's really important to engage your doctor and know about these screenings.
What's different between that test and a traditional mammogram?
Well, the GALE test is just a questionnaire. Yeah. These models are just a questionnaire to let us know who is at higher risk versus who is not, and then we can triage from there.
And another thing to note is, while it's important to engage your doctor on it, you can take them online as well, and then go to your doctor and say, look, I took this online, it says that I'm a higher risk, can you also take it for me and verify this?
Oh, I'm really glad that came out because for someone who doesn't have insurance or doesn't have healthcare provider or doesn't have access, it's good to know, not for diagnosis, but that you can take the test online.
Knowledge is power.
Actually, I wanted to invite the audience to... they made some questions for us because I love when you guys get involved.
Yeah, they sent in.
Yeah, sent in questions. So we have a few questions. I'm going to give you the first one. From Liz, I'm 55. I recently lost 100 pounds, and I am less familiar with my breasts. They look and feel different. And how can I make sure that I'm not missing anything?
I think I would say, Liz, just have a familiarity with your breast, what those new changes are. So if you find something, you can be aware. Most women come in and they were putting on lotion or taking a shower, and that's how they notice their lump. So it is really important to have an understanding of the changes that your breasts can undergo. You know, there's no perfect way to do a breast exam at home. It's just cover from the center of your chest all the way out, include your armpit, because there is breast tissue in your armpit. And if you notice any changes...
There is breast tissue in your armpit.
Extends into your
That's
armpit.
a new one for me.
Yeah, ma'am.
You know what? Here, this is a good question from Diana.
I like this one.
I am 68 years old and I have no history of breast cancer. When can I stop getting mammograms?
Diana, can you not stop getting mammograms, please?
Ever.
What cancer risk decreases with age? It increases, right? So I send my patients every single year. Please continue to get your mammogram.
Okay. That's really good information.